Non-alcoholic fatty liver disease, often known as NAFLD, is a condition that is characterized by the accumulation of excess fat in the liver, and it is not associated to the consumption of alcohol. In the past few years, there has been an upsurge in its occurrence as a result of changes in lifestyle and diet. NASH has the potential to develop into more severe chronic liver disease if it is not addressed. In this piece, we will talk about the early warning signs of fatty liver disease, as well as its symptoms, as well as the various therapy and dietary alternatives that are available to control the illness. In the present moment, there is no particular medical treatment available for NAFLD. Nevertheless, the management of this condition mostly focuses on making adjustments to one's way of life. Reducing the amount of fat that accumulates in the liver requires a number of critical components, including weight loss, exercise, and a nutritious diet. The health of the liver can be considerably improved by engaging in regular physical exercise, even if it is something as simple as walking. Activities such as aerobic activity, strength training, and flexibility exercises can be beneficial to fatty liver disease if they are incorporated into a regular exercise plan. People who have fatty liver disease absolutely need to eat a diet that is well balanced. Despite the fact that there is no universally applicable method, there are certain general dietary advice that can assist in the proper management of the disease. Receiving individualized medical guidance is something that should be prioritized. Intake of refined carbohydrates and added sugars should be reduced since a high consumption of sugar and refined carbs might make fatty liver disease worse. Restrict your consumption of sugary beverages, candies, and processed foods as much as possible. Place an emphasis on whole foods by ensuring that your diet contains a sufficient amount of fruits, vegetables, whole grains, and lean proteins. These foods are rich in nutrients and give the critical vitamins and minerals that are necessary for the liver to function properly. Avocados, almonds, seeds, and olive oil are all good sources of healthy fats. Choose these types of fats instead. Trans and saturated fats, which are frequently present in processed and fried foods, should be avoided. Take control of your portion sizes. Eating too much of anything, even nutritious foods, can lead to weight gain. When trying to maintain a healthy weight, it is important to pay attention to the size of your portions. There is a possibility that NAFLD will not exhibit any symptoms at all in its early stages. The progression of the disease, on the other hand, may cause the following symptoms to become apparent. A sense of excessive exhaustion or weakness that lasts for no obvious reason is referred to as fatigue. Having a mild ache or discomfort in the right upper abdomen is referred to as abdominal discomfort. The rapid shift in weight that occurs without any adjustments in food or exercise is referred to as unexplained weight loss or weight gain. Yellowing of the skin and eyes caused by a deterioration in liver function is referred to as jaundice. The presence of an enlarged liver is something that the physician might find out about during a standard physical examination. It should be made clear that drinking alcohol does not lead to non-alcoholic fatty liver disease, NAFLD. Both alcoholic and non-alcoholic fatty liver diseases are characterized by the buildup of fat in the liver. However, the causes and risk factors for each of these illnesses are distinct from one another. The most common risk factors for non-alcoholic fatty liver disease are being overweight, having insulin resistance, having high blood sugar, and having metabolic syndrome. Seeing a medical specialist is really necessary, as was discussed earlier. Managing underlying health disorders. Addressing and treating linked health concerns, such as obesity, type 2 diabetes, high blood pressure, and high cholesterol, can help improve non-alcoholic fatty liver disease, NAFLD. In addition to preventing future damage to the liver, controlling these disorders can lower the amount of fat that accumulates in the liver. Certain drugs may be prescribed by medical professionals in certain instances in order to assist in the management of NASH. Examples of these include insulin sensitizers or drugs that, in certain people, can improve insulin sensitivity and reduce the amount of fat that is stored in the liver. B. Vitamin E. It has been demonstrated that taking vitamin E supplements can enhance the levels of liver enzymes in some patients who currently have NASH. C. Antioxidants. Antioxidant supplements, such as vitamin C and vitamin E, have the potential to protect liver cells from the damage that is induced by oxidative stress. Remembering that drugs should always be administered and monitored by a skilled healthcare expert is something that is extremely important to keep in mind. Drugs for weight loss. In cases of severe obesity, bariatric surgery or weight loss medications may be investigated as potential options to assist in achieving significant weight reduction, which can have a good impact on non-alcoholic fatty liver disease, NAFLD. Avoid taking medications that aren't necessary. Certain medications, such as corticosteroids and certain opioids, have the potential to make NAFLD worse. If at all possible, it is advisable to avoid or limit the use of these medications, particularly when they are not under the supervision of a qualified medical professional. Consistent follow-ups and monitoring. It is essential to make consistent visits to a healthcare professional in order to track the progression of non-alcoholic fatty liver disease, NAFLD, and modify treatment strategies as required. Certain natural supplements, such as milk thistle, may be good for liver health. These supplements are referred to as liver health supplements. However, additional research is required to determine whether or not they are useful in treating NAFLD. Additionally, it is essential to seek the advice of a qualified medical expert before beginning to take any supplements. Take part in clinical trials. Researchers are always looking at other potential treatments for non-alcoholic fatty liver disease, NAFLD. Individuals who take part in clinical trials have the opportunity to make significant contributions to the development of knowledge and to gain access to novel therapeutic approaches. Recognizing the early symptoms of non-alcoholic fatty liver disease is essential for receiving treatment in a timely manner and managing the condition effectively. You should seek the advice of a medical practitioner in order to receive an accurate diagnosis and individualized direction if you are suffering any of the symptoms listed above or if you have any suspicions that you may have fatty liver disease. In addition to boosting general liver health and well-being, it is important to keep in mind that maintaining a healthy lifestyle and diet can go a long way towards preventing and controlling fatty liver disease.